Just this past January, I went for a routine physical. I've been very diligent about my health, and I told my doctor I walk for exercise and I do stretching exercises, and I talked to my doctor. I told him I was experiencing chest pains. The next thing I knew, I was in the hospital looking at a stent procedure. And so I gave the okay. The cardiologist talked with me before the procedure, and he told me that it would be, this is how it was going to be, and the medications that I was going to take. And I said, fine. I love it when I don't die. I had the procedure done, and now I am involved in taking Plavix, and I have to take cholesterol medication, and I have to take a diuretic. I don't even know the name of it. I don't even know the name of the medication. And every morning I wake up, I feel like I got steamrolled by I feel like I got steamrolled by a train. Just the cholesterol medication it wipes you out, and you're told, the cardiologist tells you when you have your follow-up appointment to the procedure, you got to do this. You got to do the Plavix, you got to do the Lipitor, the cholesterol medication, whatever it is that they prescribe for you. You've got to do this. Fine, they give you a very grim outlook. They tell you flat out that you'll have a heart attack if you don't take the Plavix. The stent will close up. The medication won't be activated that's on the stent. I felt like I was sold a bill of goods. I asked, well, why couldn't you do an angioplasty where they just clear out the obstruction? And they go, well, that doesn't work anymore. And I felt I felt locked into this. I smoke cannabis on an as-needed basis, and it makes me feel better. It takes away that tired feeling you get from taking all these lifestyle medications. Being an older guy, I take.
So you're telling me that the cannabis helps the medication that you take work better?
Yeah, it does. It absolutely does. I mean, it makes me feel better. I mean, I'm tired most of the time. I have no energy. I don't have the energy that I had prior to the stent operation. I mean, I feel good. I feel good, but for the most part, I'm laying down more than I used to. I realize a portion of it is old age and everything, but I realize that my body's been invaded by surgical steel, and I've had to slow up a little bit, and I just feel better when I use cannabis. I mean, I use cannabis not on a daily basis. Just when I feel really, really bad, it makes me feel better.
Okay, we already heard about the side effects from prescription drugs. So, what side effects from cannabis?
None actually. I get pretty hungry. I have to be.
Is that a bad thing?
No, it would definitely benefit people that are undergoing chemo or radiation therapy. With the acoustic neuroma, there's the fear that it's growing. Okay, in my case, it's kind of stabilized, so I'm very thankful for that. I'm very thankful for that. But I just I get the ringing headaches. I gotta lay down. I gotta lay down. I just want the room dark. I don't want any noise. I'm very sensitive to noise. with this condition. And
What does cannabis do for you?
well, cannabis, surprisingly enough, is the only thing that will help relieve the. I'm able to, if I smoke cannabis, I'm able to relax and listen to music and just kind of wait a certain amount of time, and the headache will go away.
How about the anxiety?
The anxiety will go away too. I mean, it just it makes me feel good. I mean, with cannabis, you get the same desired effect when you smoke cannabis every time. When you're taking prescription medications, you build up a tolerance over time. That's the one of the drawbacks to pharmaceutical medications, narcotic medications, is you build up a tolerance, and the doctors warn you, that you can build up a tolerance to it. With cannabis, you don't really build up a tolerance. You get the same desired effect every time, depending on the quality of the cannabis that you're smoking. That's one thing I've noticed with my experience with cannabis.
So for you as a member of the chronically ill, this is a quality of life issue.
Absolutely, it is a quality of life issue. I believe that people should have the choice, especially when they're if they're terminally ill. It's a person's right to be able to choose how they want to manage their pain. Because it's tough on everybody. When a person gets sick, not only affects them, it affects their family, their friends. It's a very all-encompassing thing, and I just don't understand why powers that be, the legislators, the people that make the laws, why they're unable to see this. If there's a substance that allows people to have relief, make it available for them, through a controlled situation. It's very difficult for people to obtain cannabis out on the street. The street is dangerous.
This is an opportunity right now while you're on camera to take and talk to your new state legislators. What would you like to tell them?
I would like to tell them to take a serious look at cannabis as a medical alternative. I mean, every week I'm moved by patients that come into the resource center that could benefit from medical cannabis. I mean, people that are just unable to eat, people that are having chronic pain. My goodness, they're just, they're prescribed a lot of different drugs, and the spirit that these people show is visibly affected by the heavy doses of radiation and chemotherapy. This is one thing that would help them, is medical cannabis. Please take a serious look at this. Offer it to people as an alternative. My God, people are looking, when people are sick, they want something that will help them. They don't want to be bombarded with any more prescription drugs or anything. It becomes a quality of life issue for some people that are close to the end of their lives. Take that into consideration. Anything to make a patient feel better. I feel very strongly about this. I think they need to look at it very closely and hurry up the legislation on it, because as we speak, people are dying as we speak. People that could benefit from cannabis.
That's excellent, man. Appreciate it. Thank you.